At Pabau, we are always looking for ways to improve our videos. Please like, comment, and subscribe to stay in the loop with new content.
Understanding ICD-10 diagnosis coding. ICD-10 stands for the International Classification of Diseases, 10th revision. It is a standardized system used worldwide to code diseases and conditions, supported by platforms like Pabau. In medical terms, ICD-10 provides a shared language that allows healthcare professionals to clearly describe a patient's diagnosis. It exists to ensure that the same condition is identified and recorded the same way, no matter where or by whom the care is delivered. ICD-10 is important because it directly affects patient care, clinical communication, and healthcare decision-making. Accurate diagnosis coding supports proper treatment planning, helps track disease patterns, and allows healthcare systems to monitor outcomes and public health trends. For patients, correct ICD-10 coding helps ensure their medical records are complete and that insurance claims are processed accurately. For clinicians and healthcare organizations, it supports quality reporting, research, and resource planning. In real-world clinical practice, ICD-10 is used every time a diagnosis is documented. For example, when a clinician diagnoses a patient with type 2 diabetes, an ICD-10 code is selected to specify not just the disease, but also important details such as complications or level of control. Coders and billing staff use clinical documentation to assign accurate ICD-10 codes for records, claims, and healthcare data analysis. There are several key techniques involved in using ICD-10 correctly. Selecting the most specific code based on documentation, linking diagnosis code to symptoms and findings, using combination codes for conditions and complications, updating codes as patient condition changes, reviewing official ICD-10 guidelines for compliance. When using ICD-10, it is important to be aware of limitations and common misunderstandings. ICD-10 codes describe diagnoses, not procedures or treatments. They rely heavily on clear clinical documentation, and incomplete or vague notes can lead to inaccurate coding. ICD-10 is updated regularly, requiring professionals to stay current. And while it supports population data analysis, it does not replace clinical judgment or individual patient care. In summary, ICD-10 supports accurate healthcare documentation, and platforms like Pabau help streamline this. Book a demo to see it in action.
Visit our website where we have over 6,000 free templates and resources to choose from.